Hello, my name is Leanna Tower, and today I will be teaching you about Takotsubo Cardiomyopathy. This word is a little bit hard to say, but don't worry. There is a much easier and more well-known term for this, and it is called broken heart syndrome. Broken heart syndrome occurs when the heart is temporarily stunned or weakened. It usually affects this part of the heart, which is called the left ventricle. Now, in a normal heart, when the blood comes in from the rest of the body, it comes into the right atrium, down to the right ventricle, and out through the pulmonary arteries into the lungs to be oxygenated with fresh, nice, clean oxygen and to get some nice nutrients and everything like that. And they will come back through the pulmonary veins into the left atrium, and then down into the left ventricle. Now, normally, the left ventricle it's shaped a little bit like a V, and when it's ready, it will push all of the oxygenated blood out and into the aorta to be pumped throughout the rest of the body. In an individual with Takotsubo Cardiomyopathy, or broken heart syndrome, instead of a fully normally functioning left ventricle, the top half will function about normally, but the bottom half is a little weak. So instead of normally just pushing all of it out, it's not as strong. So it's not going to push. It's going to kind of balloon. It's going to, instead of being this V shape, it's going to be a little more rounded, and it's not going to be pushing that blood out. It's just going to hold it in. Now, this can cause a couple different problems, but first we're going to go over the causes. Unfortunately, there is no absolutely determined known cause for broken heart syndrome. It is thought to be brought on by stress, stressful situations, and extreme emotion. The symptoms can include sudden chest pains and shortness of breath, and it is very commonly mistaken for a heart attack. The arteries are not blocked, but the blood flow may be reduced because it's just not pushing all the blood out to where it needs to be. Some of it is staying in the heart, so not everywhere is getting adequate amounts of blood. So some of the complications that can arise from broken heart syndrome or Takotsubo cardiomyopathy can include pulmonary edema, which is fluid in the lungs, low blood pressure because there's not enough force to get all of that blood where it needs to be, arrhythmias, heart failure, blood clots, and in rare cases it can cause death. Now, usually it's temporary, but it can come back. And when it does, it is called recurrent Takotsubo cardiomyopathy. Now, treatments can include some beta blockers, some ACE inhibitors, and some diuretics. It really depends on how severe it is and how much of a threat your physician thinks that it's going to be to you in the future. It usually, and one occurrence usually heals within 2 to 4 weeks. However, it can take up to 2 months to fully heal, which is not actually a very long recovery period. Some people are at more of a risk than others. Females are at more of a risk than males, and those over the age of 50 have an increased risk as well. And the last risk group is those with mental health conditions. They are at a slightly more of a risk than those without mental health complications or conditions. And that is my lesson about Takotsubo cardiomyopathy, more commonly known as broken heart syndrome. Thank you.